Hi everyone, Dr. Kofi here again, and welcome to Med News, a part of Tutor Med, which is focused on global issues with public health significance. Today is International Women's Day, and we want to wish every woman a happy International Women's Day. We want to celebrate today by creating awareness on some of the cancers which commonly affects women. And so before we begin our discussion, let's spend some seconds on the background history of International Women's Day. The concept of International Women's Day first emerged in the 1900s. So on the 28th of February 1908, about 15,000 American women marched through the streets of New York City, demanding shorter working hours, better pay, and then voting rights. So they were kind of fighting against the social injustice against women at the time. And so when they succeeded, the first National Women's Day, as it was then called, was celebrated on the 28th of February the following year, which was in 1909. Then, in 1977, the UN officially agreed that International Women's Day will be observed on the 8th of March every year to celebrate the economic, political, social, and cultural achievements of women. And so the first kind of cancer we want to create awareness on is cervical cancer. So we will list some of the risk factors which predisposes a woman to developing cervical cancer. The first is younger age or early age at first sexual intercourse. In other words, early coitus. That is a risk factor. And the second is having a high lifetime number of sex partners. And as you can see, this is very common among sex workers. So if you have a very high number of sex partners in your lifetime, it is a risk factor to developing cervical cancer. The third risk factor we want to talk about is cigarette smoking. Then the fourth is having a sexual partner who engages in high-risk behavior. So if your male sex partner also has multiple female sex partners, there is a risk. Then the fifth is the use of oral contraceptives, typically beyond 5 years duration. And so let's look at the signs and symptoms of cervical cancer. The first is that the woman may have an abnormal vaginal discharge, which can be very offensive or malodorous. Again, there may be a history of irregular or very heavy vaginal bleeding. Vaginal bleeding here means that it is not from the endometrium. That's why we didn't use menstrual bleeding, but vaginal bleeding. Then, there may be a history of postcoital bleeding, which is bleeding after engaging in sexual intercourse. And so as a preventive measure, kindly do well to avoid the risk factors we have mentioned earlier, including cigarette smoking, having multiple lifetime sexual partners, and then using oral contraceptives beyond 5 years. Then, a screening tool can be used to detect cervical cancer early. It is called pap smear, and so kindly get a pap smear done at least once a year. The next cancer we want to talk about is breast cancer. And so let's begin with the risk factors which predisposes a woman to developing breast cancer. The first is age, typically above 50 years. And then if there is a family history of breast cancer, it increases the risk, maybe your mother or your sister. If there is a past history of breast cancer, someone has had breast cancer and has been treated before, there is a risk of recurrence. Then, early menarche, meaning early age at first menstruation. Then nulliparity, meaning a woman who has not given birth before. And then late menopause, meaning a woman who took a very long time before stopping menstruation. All these conditions or all these events exposes the woman to so much estrogen, and estrogen excess has been linked to the development of breast cancer. Then the use of oral contraceptives has also been shown to increase the risk slightly. Then hormonal therapy for postmenopausal women who have become postmenopausal sometimes are given estrogens to help ameliorate the symptoms of menopause. Hormonal therapy here can also increase the risk of breast CA or breast cancer. Then cigarette smoking and alcohol abuse have also been implicated. And then a woman who takes in wrong diets like very high fat containing foods. Obesity has also been linked with breast CA. But there is no evidence that changing your diet improves the risk. However, wrong diet can increase the risk. And so let's look at the signs and symptoms of breast cancer. And so you may find out that there may be a lump in the breast. A lump in the breast does not mean it is breast cancer, but you should seek medical attention. You may find that the nipple, instead of pointing outwards, has been pulled in, and so that's a pulled in nipple. You may find that the skin has dimpled, skin retraction. That may also be a sign. You may find out that the nipple is discharging blood, but I should point out that a bloody nipple discharge is not necessarily breast cancer. In fact, the most common cause of bloody nipple discharge is not breast cancer, but it may indicate breast cancer. Then again, you may find that the skin has become red or there is some rash on the skin. You should seek medical attention. And then there may be some skin changes, like you might find nodules on the skin. The skin of the breast can ulcerate. All these are symptoms of breast cancer. And so what can you be doing to prevent the development of breast cancer? Kindly take care of the risk factors mentioned earlier, some of which are modifiable, like the cigarette smoking, and then the alcohol abuse, and then the long use of oral contraceptives. There are some which cannot be modified, like family history and your age. That one, you can't do anything about it. However, you can be doing a monthly breast self-examination to look for the symptoms and signs we mentioned. So you stand in front of your mirror and then you look for breast lumps, nipple changes like nipple retraction or nipple deviation or nipple discharge, or some breast changes, whether one is bigger than the other or one is smaller than the other. Then you can be doing regular mammogram or mammography or breast ultrasound. Typically, mammography is done for elderly patients and breast ultrasound is done for relatively younger patients. They are good at picking lesions that your breast self-examination might not be able to pick. Then finally, participate in the October breast cancer screening exercise that is organized every year in the month of October, so that you can be examined properly by a health care provider. Kindly note that breast cancer is curable when detected early, and early detection saves lives. Happy Women's Day or Happy International Women's Day. Bye.